Can heart disease be prevented even with my family history? Mom, dad, brothers, or sisters have had heart disease. For women in the family, if they had heart disease less than 65 years old, and for the men in the family, if they had heart disease when they were less than 55 years old, then that means that you have family history of heart disease. Now, let's say you have family history. What can we do about it? So friends, yes, absolutely. In majority of the cases, even if you have a strong family history of heart disease, it can be prevented if you make the necessary lifestyle changes, because the modifiable factors or the lifestyle factors play a major role in the development of coronary artery disease. And in most instances, aggressively controlling these factors and treating your risk factors can cut your risk of having coronary artery disease by 50%, even if you have a strong family history. So friends, let's first understand what it means to have a family history of heart disease. So if your first degree relative, meaning mom, dad, brothers, or sisters have had heart disease, for women in the family, if they had heart disease less than 65 years old, and for the men in the family, if they had heart disease when they were less than 55 years old, then that means that you have family history of heart disease. Now, grandmother, grandfather, and people older than the age limit that we talked about do not necessarily account for a family history of heart disease. Now, let's say you have family history. What can we do about it? Studies have shown that if you get regular checkups and if you have a family history, you can get your lipoprotein A level checked, or alternatively, you can also get a coronary artery calcium score. And this is prognostic and will tell your future risk of developing heart disease. Now, if this is elevated, what can be done? The first and foremost thing is the diet. Plant-based diet, whole food diet, or a Mediterranean type of diet has been consistently shown to reduce the risk of heart disease. So we highly recommend that you stay away from processed foods as well as sugar, salt, and pizzas, pastas, burgers. These are deficient in nutrients and do not give your body the energy that it needs, and in fact increases your cholesterol in the body, which is very bad for your heart. Number 2, it is very important to remain active. We recommend at least 30 minutes of aerobic exercise every day. American Heart Association recommends that you need to exercise at least 150 minutes per week, and you can break it down as you like. It could be 30 minutes for 5 days a week, or it could be split any way you want. But the exercise has immense benefits for your heart health and reduces the risk of heart disease. Number 3, rest. Friends, rest is important for the body as well as for the mind. For the body, you have to take at least 7 to 8 hours of sleep every single day and a minimum of 6 hours. And for your mind, you have to practice meditation and yoga techniques, because these have been shown to reduce the levels of stress hormones like cortisol in your body. And when this happens, your blood pressure naturally goes down, your heart rate naturally goes down, which decreases the risk of you developing heart disease. And also, when you have more mind and body awareness, you will be much less likely to go for emotional eating, which causes weight gain and obesity, which further increases your chances of heart disease. And friends, it is very important to breathe. When I say breathe, what does it mean? It means you have to try and breathe fresh air. Try to go for a walk where there is greenery around you. And most importantly, stay away from any kind of smoking, which could be first hand or it could be second hand smoke also. The smoking causes significant inflammation throughout your body and especially your coronary arteries. And this inflammation causes a trigger for platelet aggregation, and this results in clot formation. So friends, if you have family history of coronary artery disease, then remember this mnemonic. Know how to move and eat, rest and breathe. Moving is for exercise. Eating is for plant-based diet. Resting is by sleeping and yoga meditation. And breathing is by not smoking. And friends, when you know you have family disease, you should get your blood pressure checked, blood sugar checked, and cholesterol level checked regularly as well, so that you can minimize these risk factors and cut your chances of having heart disease by more than 50%. I hope this information was helpful. If you have any other questions for me, please feel free to comment. And do not forget to like and subscribe our channel for such content. Thank you.